Every year, over 8 million people lose their lives to a common enemy, largely hidden in plain sight. This enemy isn't war, famine, or even a pandemic. It's tobacco. The global tobacco epidemic remains a significant public health threat, not just to those who partake in the habit, but to everyone around them. Governments worldwide have been implementing policies to reduce tobacco consumption, including higher taxes on tobacco products, smoke-free public spaces, and graphic warning labels on cigarette packaging. However, new tobacco products such as e-cigarettes and heated tobacco products pose new challenges to global efforts to reduce tobacco-related deaths. One such product is nicotine pouches, which are marketed as a less harmful alternative to smoking.
They are looking at them as harm reduction products or as alternatives to tobacco, to cigarettes and all that. But again, the way there's not enough research done to ascertain their safety.
These pouches contain nicotine, but the industry claims they are tobacco-free and smoke-free.
They are trying to show as though they are addressing the issue about harm reduction. So that is one media in terms of the website of the tobacco industry, where they are presenting this as a safe alternative to cigarettes or to other tobacco products.
Nicotine affects children and adolescents because nicotine is an addictive substance, and you find that this age group, they get addicted very fast, and it has been documented that nicotine can affect the growing brain of the child and the adolescent child.
Nicotine is put into pouches, which are then filled with flavored powder that contains nicotine, which is absorbed through the gums and into the bloodstream. The rise of the use of the nicotine pouches as countries try to fight the use of tobacco has forced other countries like Netherlands, Belgium, and Kenya to ban the products. In 2019, the sale of nicotine pouches in Kenya was stopped after the country's then health minister, Mutahi Kagwe, queried why they were regulated by the Pharmacy and Poisons Board and not the Tobacco Control Board under the Tobacco Control Act of 2007.
A letter to the Pharmacy and Poisons Board, Kagwe accused it of violating several provisions of the law in licensing of the product. The CS further says the ministry's surveillance had revealed that the product was being dispensed in automatic vending machines, contrary to the law.
We had a restriction on sale of Lift that was pronounced by the then Health Cabinet Secretary Mutahi Kagwe. That led to Lift being removed from markets and shelves in Kenya. However, what we see right now, of course, especially with the advent of Velo, is that it shows that there is a weakness and a gap in how that pronouncement is being enforced. Because as far as we know, that restriction has never been lifted. So we have, it brings many questions. How come Velo is being sold and Velo is just a nicotine pouch, just like Lift, whereas the sale of Lift was restricted and the same was removed as per guidance that was given by the then Health CS Minister.
CS Kagwe said he had written a letter to the Pharmacy and Poisons Board pointing out that they are flouting tobacco control laws that apply to the licensing of Lift for sale in the Kenyan market. In a subsequent letter dated January 21st, 2021, the former health CS told the BAT its pouches can only be sold by adhering to the Tobacco Control Act. He said They must have images that show the debilitating damages the pouches cause in a user's body, and they must not be advertised at all. In a letter dated February 18, 2021, BAT wrote to the Ministry of Health acknowledging the letter from them. BAT in the letter also mentioned they had received a letter dated February 9, 2021 from the Tobacco Control Board, which requires compliance with the provisions of the Act and regulations with immediate effect, and specifically the requirement to comply with packaging and labeling requirements within 21 days from February 9, 2021. In their letter to the ministry, BAT also requests a 9-month transition to be able to sell the stock, which was 400,000 cans of lift worth 33 million shillings. A source at the ministry says the request was denied until BAT adhered to the set requirements. Apparently, the products were allowed back in 2022 after consensus that they should be regulated by the Ministry of Health with the advice of the Tobacco Control Board, meaning that they are treated as tobacco products. However, there is no such communication in the public domain.
As WHO, we are aware of the ban that the government has taken in place to ban nicotine pouches in the country. But the main problem here is now the enforcement, because as we talk now, we find that these pouches are found in supermarkets and children can access them.
And the products are sold openly online.
Nicotine pouches being an emerging tobacco product, we also found out that a huge percentage of youths are attracted to these flavored tobacco products. One of them, for example, Lift and Velo, because of the flavorings that are in this product, which actually lead them to experiment with many other tobacco products that are also available in the market.
17 years old. I'm a candidate from 4. Maybe class 6, 7. Hizi vitu ziko kwa maduka. Mtaani tu bado kuna venye tunaweza zipata.
I'm 17, form 1. Hiyo tulikuwa yani group vile boys wanakaga. Saa one of the guys akakuja na idea akatupatia. Hiyo ndio ilikuwa siku ya kwanza kuitest.
I am 16 years, form 2. On 2019. Saa zingine katika sijaenda shule, siku kama holiday Saturday, na kugari kwa group ya usafi. Okay. Fagia mtaro. Sasa tukifagia jioni, tunaenda kuchukua pesa. 250 ama 300.
Our team visited 3 major cities in Kenya: Mombasa, Nakuru, and Nairobi, just to see the availability of nicotine pouches.
Ziko kwa shops. Ya juu hata ukiangalia yenyewe, unaona iko na alama ya kebs.
Juu watu wengi wanaamini kebs inabidi sisi tunatumia juu iko na kebs, unacheki.
Even the fact that Velo, these new nicotine pouches being sold in the market, and it actually bears the KEBS standard mark of quality, is misleading the public, because that mark, I mean, when the public sees that mark, they associate it with safety, they associate it that this product has been, is compliant to the laid standards or provisions and regulations, whereas I'm not sure that is the case with the Velo and even other nicotine pouches.
Your campus, I experimented with a lot of things, and one of them was tobacco. So nilikuwa natumianga hii tobacco fulani inaitwa ndovu, but the thing about ndovu ni kuna design inakuchoma mdomo, kama hizo piko fiti inakuchoma mdomo, alafu kama mtu anaweza jua tu umeiweka kwa mdomo, unaona, ukitaka kutema mtu ana notice or anything, Sasa ndio msee fulani tu akaniambia kuna kitu hii fulani, at the time hii ilikuwa inaitangwa lift. Akaniambia kuna hii lift ni rada safi, ni flavored, kuitumia kutema ni hakuna mtu hata atanotice. Unaweza ongea na msee hata akose kujua unatumianga hii stuff. So nikaijaribu na hivyo ndio nilianza kuitumia. Most of the time kama ujizoea haufai kuanza na hii strength. Unajua kuna mild, kuna medium na strong. So hii strong haufai kuanza nayo. So ukijipata we ni beginner na unaanza na hiyo strong, itakupeleka mbio sana.
Watu iko na makastoma wengi sana. Nikinunua hii kama 3 nitauza moja mbao nipate profit kama ya 10 bob each.
If someone cannot buy the entire pouch or the entire tin, then they can buy the single bag from the people who are buying the big item, and then the big package, then selling them in smaller units.
Nilikuwa natumia sigara. Hiki kitu mimi nilianza kutumia nikiwa jela. Ikawa natumia ugoro. Ugoro ilipokuja katika kuja mwanamke mmoja kuzungu alishikwa. Sawa, akabeba. Ikawa wow, more powerful than even that ugoro we are using. Ilikuwa useless hata ugoro, ilikuwa haina mpango tena. Mara ya kwanza kupata lift nilikuwa na rafiki yangu tunakuwa pub. Nikaona rafiki yangu alikuwa na hizo kind of tobacco ambayo anaweka kwa mdomo, anamumunya. Nikamuuliza ni nini, na by then sikuwa na tobacco hapo ile ambao wanatumianga ya kienyeji. Ndio maana nikataka kujua hii kitu mwenzangu anatumia ni nini. Nilivyomuomba akanisaidia nayo, na nilikula mara ya kwanza nikasikia iko mzuri sana, mpaka nikamwambia mazee, inanipeleka hai hadi nataka container mzima.
I would want to confirm that the nicotine pouches are in our market, and what happens is that the importation is restricted, not prohibited, but restricted. That is, if you want to import, you must get a permit from Kenya Ports Health. You also must get a permit from Kenya Bureau, and you also must register as an importer with the KRA.
Primary legislation for manufacture, production, selling, labeling for nicotine products is actually the Tobacco Control Act of 2007, which is also supported now by the Tobacco Control Regulations of 2014. So those are the two pieces of legislation that govern how the nicotine-based products are produced, manufactured, advertised, sold, and labeling.
Increasing tobacco taxes is the most cost-effective method of reducing tobacco consumption. Higher taxes raise the retail price of tobacco products and make them less affordable. They also increase government revenue.
We have collected about 100 million in this financial year. That is between June 2022 up to May this year. We have collected around close to 100 million in terms of taxes.
In low and middle income countries, studies have shown that increasing the price of cigarettes by 10% leads to an average 8% decrease in tobacco demand. In Kenya, the sale of the pouches attracts 1,500 shillings excise duty per kilogram from July 2022, following the enforcement of the Finance Act 2022, increasing from 1,200 shillings previously.
Excise tax is considered public health tool because it encourages or rather discourages consumption of such harmful products, for instance tobacco products. And whereas that is a tool that is used as a measure for reducing consumption, what we are seeing currently in terms of the revenue that government is collecting through importation of velo is actually the opposite. It is not taxes that are driving down consumption. They are not. It's not revenue that is coming as a result of taxation that is being felt by consumers, precisely excise duty, but rather there are other types of taxes. So when we hear that the Revenue Authority has actually been collecting hundreds of millions in just 1 year through importation of velo, yes, government is getting revenue out of it, but what that is doing is that it's just making these products more available, and especially worrying is that it's making the products available in an environment that is not clear in terms of how these products are being regulated, especially to control their availability and their access amongst the Kenyan public.
The current tax is, however, significantly lower than the 2,500 shillings per kilo that had been proposed by the National Treasury before it was lowered by lawmakers. BAT has in the past, through the Kenya Association of Manufacturers, unsuccessfully proposed a duty of 757 shillings per kilo. Even though nicotine pouches are back in the market, their packaging fails to adequately disclose the associated health risks and effects as mandated by the law.
It means that these products must comply with the provisions that are given, including health warnings.
The provision that talks about compliance of tobacco products in terms of packaging and labeling is section 21, okay, which stipulates that the graphical health warnings shall be 30% and 50%. The nicotine pouches does not comply with the provisions of the Tobacco Control Act, and specifically section number 21, whereby these products, just like any other tobacco products, must have graphical health warnings.
In Kenya, the regulation of all tobacco products and nicotine pouches falls under the Tobacco Control Act of 2007. This act requires that the packaging of such products should display warning messages in both English and Swahili languages. For smokeless tobacco products, the Act specifies that these warning messages should occupy at least 30% of the front cover and 50% of the back cover, presented in both textual and pictorial forms. Regrettably, nicotine pouches products in the Kenyan market have not yet complied with these requirements.
We are still not seeing them being labeled according to the Act and also to the Tobacco Control Regulations 2014. And we are seeing gaps in terms of the capacity also of the government, the Ministry of Health specifically, and the Tobacco Control Board to regulate these products.
One company that sells nicotine pouches in Kenya is British American Tobacco, which argues that the nicotine pouches are labeled as tobacco-free, indicating that they are manufactured in laboratories and do not involve the extraction of nicotine from tobacco, as is the case with traditional oral products.
Tobacco is a major risk factor for non-communicable diseases, or I can say even conditions, because tobacco causes cancers, tobacco is associated with heart diseases, tobacco is associated with the kidney diseases, tobacco is associated with diabetes, tobacco is associated with chronic lung diseases, many of them. So tobacco is a big health risk factor and contributes to disease and disability and even death.
With mystery surrounding lifting of the ban and nicotine pouches, questionable compliance of Kenyan laws, how are these products still in the market?
These products were recalled from the market. They were to comply with the Tobacco Control Act 2007. They also to comply with the Tobacco Control Regulations 2014. They have not complied. The labeling is not yet there. We don't have standards for these products. I know that the Kenya Bureau of Standards has been trying hard to introduce standards. So I would say that as of now, they are not complying to the existing tobacco control regulations, the Tobacco Control Act, and that there is no other regulation that they are complying with.
Inconsistent regulations and lack of coordination in enforcement has created confusion and loopholes for the industry to exploit.
It is a shame that even after lift being registered irregularly and Ministry of Health actually pointing out that the product was registered irregularly under the Pharmacy and Poisons Board, that up to now no action has been taken.
The only issue that we sometimes find is that there are issues of enforcement, are issues, and a big interference by the tobacco industry.
Harmonizing enforcement efforts across the relevant agencies can help prevent such failures and ensure that the public health concerns are addressed consistently and effectively. Nicotine pouches are harmful, addictive, and are jeopardizing public health. If left unchecked, there will be catastrophic effects to the youth, the economy, and the country at large. It's time to act now to protect our future and ensure a healthier, thriving nation for generations to come.